The following portion of Good Day PA is sponsored by WellSpan Health for patients with a form of chronic low back pain called this is going to be hard, vertebrogenic pain. I think I got it. WellSpan offers the Intercept procedure. It is minimally invasive and it's done in outpatient. Pain medicine specialist Dr. Malgorzata Sider joins me now to share more about this. I know we talked about this once before. It's really interesting what it is. You are a pain medicine specialist.
Yes.
So thank goodness, right? So,
yes.
So tell us what it is that you do.
So pain medicine specialists specialize in figuring out what the cause of your pain is, whether it's acute or chronic. Everyone has some level of pain. And when it becomes debilitating, it's time to turn to a specialist to figure out how to kind of get back on track. And we can do that through a variety of things. We use various diagnostic imaging, we use conservative management to treat it, including physical therapy, medication management, as well as interventions. And interventions are the exciting part, because once you figure out what causes pain, if you find the right treatment, you can let the patient kind of move on with their lives.
Yes, thank goodness.
And we do a lot of various procedures these days that are not even steroid-based, because historically we were so dependent on steroids, but those never really gave you a longer-term pain relief. And that was very frustrating for us, as we want to see our patients do really well.
Right.
And for the patients themselves, because who wants to keep undergoing the same procedures over and over again, right? Exactly. So we do spinal cord stimulation, which is a long-term procedure, and we do peripheral nerve stimulation, which can be a really nice long-term treatment, as well as various ablations. And these could be conventional ablations, Cooley radiofrequency ablations, as well as Intracept.
Okay, so tell us about Intercept, because it's very unique.
It is very unique, and it's brand new, FDA approved, very exciting, and we're very lucky that we're able to offer it to our patients, because until recently, until about a year or 2 years ago, we had no way of treating vertebrogenic pain. And vertebrogenic pain is low back pain that comes from the inflammation and arthritis that creeps into the vertebral bodies. And vertebral bodies in our spine are equivalent to a building blocks of a house. Very important and vital to our movement, range of motion, and existence. And if they're not happy, they will send us signals to our brain saying, hey, we're not happy, we're having pain, inflammation there, do something about it.
Then how does Intercept work? How does it help with that pain?
Intercept is a very minimally invasive procedure, outpatient, as you mentioned already, where we make a very tiny incision and pass a probe through your muscle into the vertebral body. There's a nerve there, we know exactly where it sits, and we apply heat to the nerve. Heat destroys nerve. And there's very good data, at least 5-year data, where we see that once this nerve is destroyed, it is very unlikely to ever come back.
Wow.
So you can have lifelong relief from vertebrogenic back pain through this 1 hour long procedure when you're asleep, and when you wake up, you're done.
That's remarkable and absolutely life-changing.
It is life-changing, I agree.
Okay, so you're going to stay here because we're going to talk a little bit more
Okay.
about this coming up. We actually have a patient here who's going to talk about her experience, so keep it right here. We're back with Dr. Sider of WellSpan Health. Joining us is one of her patients who underwent the Intercept procedure. This is Michelle Lynch. So how long ago did you undergo this?
December of last year.
Okay, so not that long ago. How long had you been suffering? It was back pain, right?
10 to 15 years.
Ooh, ouch, ouch. And what was the impact of that on your life, that suffering?
Standing to do the dishes was terrible.
Oh my gosh.
That's how bad it was. Yeah.
So you had naturally tried other modes of treatment, right? And it just wasn't the right thing. That must have been frustrating.
Very, very.
So
I've been to the chiropractor, physical therapy, other injections, nothing helped.
Nothing. Except for
Intercept,
right? So how did you learn about that procedure and decide, I'm going to give it a try?
Through going to the pain clinic and them telling me that this was a new procedure.
Was it instant relief?
Basically, yes. After about maybe a week. Yeah.
Really? And how has that just changed day to day in the last, about 6 months?
I can do just about anything. I have no back pain. I had hip pain I don't have any hip pain anymore. It's basically all gone. I used to take 1,600 milligrams of ibuprofen every day. I
just to get through the day.
That. Yep.
Yeah.
Yeah.
Because having chronic pain, that really, I think, mentally drains you. What do you say, mentally and emotionally
Yes.
drains you too? It's revolutionary, clearly, for someone who thought maybe I have no hope and I'm going to have to live with this pain for the rest of my life. That's a very hopeless feeling. And now, I mean, look at her, she's doing great, right? So what can you say to other viewers who may be suffering with back pain and maybe should investigate this?
Don't suffer in silence. Don't give up. We have new treatments all the time coming out. This one is revolutionary. If you've been ever in a position where someone told you there's nothing else we can do, now we can. Reach out to the nearest WellSpan Pain Clinic. Find out what we can do. You have nothing to lose, and you have everything to gain. Everything to gain.
You just said something that I think is a great point. There could be people who have been suffering for 10 to 15 years, right? And had previously been told, like, sorry, like, we've really exhausted this. I'm so sorry, but you're gonna have to deal with this. You say those patients, no, call now.
Call now, because you may have suffered from vertebrogenic pain. And since we had no way of treating it before, there was nothing we were able to offer. And we probably have failed you. And now we can do something about it.
You're too hard on yourself. You didn't fail anybody.
That's okay.
Science and medicine is constantly,
it's a progressive,
yeah.
yes, exactly, and that's what's exciting. And that gives us hope for a better life for people.
And just finally, is there anybody who's a better candidate for this, or?
People that have low back pain, maybe pain going into the hips, but not necessarily down the legs.
Okay, all right. So just, give your doctors WellSpan a call and they can evaluate you and see if maybe this can change your life the way it changed this lady's life right
Absolutely.
here. Big smile, right? Feeling good. Thank you so much for being on the show with us today.
Thank you. It's great to be here.
Thank you. The previous portion of Good Day PA was sponsored by WellSpan Health.